Philippines became more important to the US, both politically and economically. Politically, because it will serve as the new epicenter of the US military strategy in the Asia-Pacific region. It will be the new launching pad of the US military in the region. Economically, because the US is interested much in the oil deposits in the southern regions of Palawan and Mindanao. The US has found a staunch... Can someone close the lights here? Yes. Someone please close the lights. The US has found a staunch ally in the person of President Gloria Macapagal Arroyo. And in a classic Freudian slip of the tongue, US free market reforms, and she even supported the US war on terror even more. She even sent a Philippine contingent, military contingent, to Iraq. So every day, there's imperialist globalization policies causes more and more illness and suffering in the country. The unemployment rate is highest in 5 decades, with 8.5 million Filipinos unemployed. The deepening economic crisis has resulted in greater suffering of the people. And this has resulted in the budget that should have been given to social services are being siphoned off to pay huge external debts and to sponsor military activities. The deepening economic and political crisis has led to so much unrest. But what is the answer of the Arroyo regime to these protests? Fascism and political repression. Since 2003, President Arroyo has been pushing for the passage of an anti-terrorism bill similar to the US Patriot Act that seeks to clamp down on civil liberties and other human rights. Because of the people's resistance, Congress is unable to pass this bill for the past 2.5 years. But even without this bill, the Arroyo regime has implemented scores of fascist activities, such as bombings, strafing, and burning of homes by military troops in the provinces of the Philippines. This is in Surigao province in southern Mindanao. They bombed this area to clear it of the people who are living there, so that US companies, giant agricultural companies, can come in and claim the land. From 2001, the Arroyo regime has already killed 516 of my colleagues. These are leaders of progressive organizations in the Philippines. There are 2 movements in the Philippines resisting the government, the legal and the underground movement. Arroyo's military could not find the underground movement, so they decided to target the legal groups. Though these people are unarmed and they are very susceptible to attacks, even in broad daylight. According to a human rights group in the Philippines, Karapatan, there are already 3,150 cases of human rights violations against peasant groups, workers, urban and rural poor associations, even Muslim groups, national minorities, and other sectors who are critical of government policies. Even health workers are not spared. Medical mission teams are being stopped from doing their job and providing relief to people in war areas. Health personnel are being tailed by civilian military operatives from their place of work to their offices to their homes. Offices of health programs are being bugged and put on surveillance. Even asking for salary increases is already a crime in the Philippines. The Department of last year and this year also, health workers were blocked by police forces at the Department of Budget and Management when they tried to press for their salary increase. Despite all these, the Filipino people are still standing up, fighting for what is rightfully theirs. It has even intensified, and with more and more rallies being conducted every week, this time for the ouster of President Gloria Macapagal-Arroyo. Some have even taken a higher plane of struggle and have already joined the underground forces of the New People's Army under the leadership of the Communist Party of the Philippines. This is the largest revolution movement and the largest and only revolutionary movement in the Philippines. So let me end this by saying that the struggle for health is an integral part of the people's struggle against imperialist globalization and the war against state terrorism. Thank you. For our next speaker, let me introduce to you a NGO worker from the Society of Women Against AIDS in Africa. She is Amy Mawaldi.
Bonjour, je vous présente ici la guerre au Congo, c'est-à-dire en République démocratique du Congo. Je vous donne les quelques conséquences que la guerre a provoquées au Congo. Premièrement, la destruction des structures sanitaires et de développement qui entraîne l'inaccessibilité aux soins de santé primaires par la population appauvrie. En deuxième lieu, il y a la violation des droits humains qui se manifeste par le massacre, les viols de femmes, les femmes enceintes éventrées, les personnes enterrées vivantes. Il y a aussi le mouvement migratoire massif, augmentant la pauvreté. Quelles sont les activités que nous faisons pour prévenir les maladies? Nous faisons l'aménagement des sources d'eau potable, vulgarisation des moustiquaires imprégnés, disponibilisation des médicaments essentiels pour les centres de santé, information, éducation et communication dans les cas de réfugiés, la formation des accoucheuses traditionnelles, mais nous avons aussi les contraintes. Les contraintes que nous trouvons, il y a l'insécurité permanente, insuffisance des moyens. Et pour terminer, en zone de conflit permanent, il est difficile de maintenir et de promouvoir la santé de la population. Malgré sa vulnérabilité, parce que les moyens sont limités et les besoins sont énormes, je dis et je vous remercie.
Good morning, ladies and gentlemen. My presentation is Violence Against Women in DRC, a Challenge to Human Rights. The violence against women in DRC is a sexual assault carried out by armed rebels. It is a mortal torture. It is a physical and psychological trauma. How it's carried out. How it's carried out. Women are raped by several men, from 2 to 10 men, in front of their husbands and children. 2, if husband resists, they are killed. 3, rebels force young men to have sex with their mothers in front of their fathers. 4, rebels force young girls to have sex with their fathers in front of their mothers. 5, rebels force young men to have anal sex with their fathers and vice versa. All those acts are against African culture, human rights, and are uncivilized. Consequences. First, contraction of venereal diseases and HIV/AIDS. 2, these acts subject the victims to be despised by the society. 3, following these acts, women are subject to stigma. 4, women encounter gynecological problems like fistula, urinary tract infections, and isolation. 5, women fail to carry on their social responsibility of caring their families and tribes. Thank you for your attention.
El siguiente testimonio procede del compañero Yesid Camacho, que nos va a hablar del Plan Colombia y sus impactos, desde el colectivo de abogados José Alvear Restrepo y otras organizaciones sindicales.
Primero que todo, un agradecimiento por el espacio que nos han brindado. Pues realmente yo soy el presidente del Sindicato de la Salud de Colombia de Antojo. Trabajamos conjuntamente con el Alvear Restrepo y con otra serie de organizaciones en un proceso de exigibilidad que lo lidera el Movimiento por la Salud en Colombia. Quizá en Colombia tenemos una situación de implementación de la política de ajuste estructural mucho más desarrollada que en muchos países del mundo, pero además en unas condiciones particularmente distintas y especiales. Colombia es un país que tiene un conflicto armado que tiene más de 50 años de existencia, pero que a partir del ingreso al gobierno del doctor Álvaro Uribe Vélez desapareció de la política colombiana. Para el nuevo presidente y para la casta política colombiana no hay conflicto armado en Colombia. Hoy lo que hay es una lucha contra el terrorismo y el narcotráfico, y en eso se centra el Plan Colombia y el Plan Patriotas. No en la solución de un conflicto armado, sino en la aniquilación de bandas de terroristas, tal y como las ha denominado el actual presidente de la República. Obviamente que si la visión que se tiene del conflicto por parte del gobierno es el de que no es un conflicto armado, que no hay una lucha política, que no hay una lucha por el poder, que no hay una lucha de clases al interior del país, el tratamiento que se le da al conflicto es totalmente diferente, y el tratamiento que se le da es el tratamiento de aniquilación de narcotraficantes y terroristas. Y obvio, todo aquel que se oponga al gobierno es calificado como amigo del terrorismo. Todo aquel que no comparta la política del Estado y dentro de ella la política de ajuste estructural en materia de salud es amigo del terrorismo. Pero además tenemos uno de los países con mayores niveles de paramilitarismo. El gobierno colombiano actúa cogido de la mano de las bandas de paramilitares. Hoy supuestamente hay una negociación en Colombia con grupos paramilitares. Yo siempre he dicho, y muchos decimos en Colombia, que uno negocia con el que es el enemigo. Entre amigos es muy difícil la negociación, o no hay negociación, simplemente lo que se puede generar entre amigos es un proceso de alcahuetería, un proceso de impunidad, y eso es lo que se está aprobando en una ley que llaman de justicia y paz en Colombia, que no es otra cosa que una ley de impunidad, porque no hay ni verdad, ni justicia, ni reparación para las víctimas de esa gran violencia. Y tenemos que decir que los trabajadores de la salud en Colombia somos de las principales víctimas de este proceso de impunidad. ¿Y por qué? En los últimos 4 años se ha empezado todo el proceso violento de privatización y de desregularización laboral en Colombia. De más o menos 120.000 trabajadores que teníamos vínculo laboral en Colombia, con el proceso de ajuste estructural, hoy únicamente 40.000 trabajadores tienen vínculo laboral. Los demás tienen relaciones absolutamente tercerizadas, relaciones de maquila. La mayoría de los hospitales y toda la salud está en manos de unas que llaman aseguradoras, de las cuales el 50% de esas aseguradoras son propiedad de grupos paramilitares. El solo señor Jorge 40, un jefe paramilitar de los que está negociando con el gobierno colombiano, controla 24 aseguradoras de salud en Colombia. Pero además, obviamente, quien se opone al proceso de ajuste estructural es asesinado. De solo Antón, en los últimos 4 años van 120 muertos, dirigentes sindicales. Cerca de 45 desaparecidos. Alrededor de 700 desplazados. 50 compañeros exilados en otros países, con sus familias enteras. Tenemos más de 1000 compañeros amenazados por los grupos paramilitares y tenemos cerca de 70 detenciones arbitrarias. Todos debieron conocer que el año pasado en Arauca fue asesinado el presidente de la seccional de Antón en el departamento de Arauca por el propio ejército colombiano. Y lo que salió por los medios de comunicación fue que habían sido asesinados 3 dirigentes sindicales, dentro de ellos el compañero Jorge Prieto, en un enfrentamiento armado. Posteriormente, por la intervención de la comunidad internacional y los organismos de derechos humanos, se logró comprobar que a los compañeros se los habían asesinado fuera de la casa, puestos de rodillas y con tiros de gracia en la cabeza. Todo ese tipo de procedimientos se ejercen no solamente por los grupos paramilitares, sino por el propio ejército colombiano. Es decir, que nosotros asistimos a una política de ajuste, de privatización de la salud. En estos momentos ya nos han anunciado 6 transnacionales que van descaradamente, por los medios de comunicación lo han dicho, van por los 150 hospitales públicos más grandes de Colombia. El método es decir, vamos a capitalizar a los 150 hospitales públicos más grandes. Y para eso generan un proceso de marchitamiento y un proceso de presión para los trabajadores para que renuncien a su cargo, como mantenerlos sin salario por más de 30 meses. El promedio de deuda salarial en el sector público en Colombia es del orden de los 24 meses. Es decir, que hay trabajadores que en este momento no han recibido el salario de hace 2 años. Y eso lo utilizan como mecanismo de presión, pero si además sale a protestar y a exigir que le paguen su salario, que no le privaticen su hospital, inmediatamente le caen los grupos paramilitares, lo desplazan, primero lo amenazan, y le exigen que se vaya de su pueblo, y si no se va de su pueblo, inmediatamente lo asesinan o asesinan a un miembro de su familia. Ante ese tipo de mecanismos de guerra sucia, de guerra atroz, asistimos en Colombia. Sin embargo, el gobierno colombiano dice que la negociación que está haciendo con los grupos paramilitares es la panacea en materia de paz en el territorio colombiano. Muchas gracias.
Desde México, desde Chiapas, nos acompañan María Flor Díaz Pérez y Sabino Pérez Gómez. Son promotores de salud, integrantes de la red de promotores y promotoras de salud en busca de una vida digna de Chiapas, en México. Y el tema es Resistiendo el conflicto, salud comunitaria en Chiapas.
Buenos días a todos y a todas. Mi nombre es María Flor Díaz y mi compañero Sabino. Somos promotores indígenas tzotziles del estado de Chiapas. Y quiero presentarles el trabajo que estamos haciendo como red de promotores y promotoras de salud en el estado en una situación de militarización. En 1994, indígenas declararon la guerra al gobierno mexicano y a partir de ese tiempo, la militarización de los territorios indígenas no se ha detenido. La prensa publicó recientemente esta noticia. De acuerdo a la ONG, existen 91 posiciones militares que ocupan 5.000 hectáreas que representa la quinta parte del territorio de la Sedena en todo el país. Este mapa representa los territorios donde se encuentran los indígenas en Chiapas. En los territorios indígenas donde se encuentran las posiciones militares. También los puestos de policías están principalmente en nuestros territorios. Aquí vemos que los grupos paramilitares también están en nuestras tierras. En nuestras tierras también existen muchas riquezas naturales como el petróleo y una gran biodiversidad. Estos son algunos de los defectos que la militarización causa en nuestras comunidades. La prostitución, drogadicción, alcoholismo, la violación de las mujeres de parte de los militares, la migración que cada vez es más fuerte, desplazamiento de las personas mayoritariamente indígenas, y tenemos las respuestas que nosotros hemos hecho.
Bueno, para enfrentar en esta situación que vivimos, nosotros como promotores y promotoras de salud en Chiapas nos capacitamos, entendemos a las personas enfermas, prevenimos las enfermedades, organizamos acciones de mejoramiento ambiental, compartimos nuestros conocimientos y experiencias, planeamos y evaluamos nuestro trabajo, analizamos la realidad que nos rodea, nos coordinamos con grupos de salud, tenemos propuestas para el cumplimiento del derecho a la salud, integramos nuestra cultura y forma de curar, promovemos la integridad de las mujeres, promovemos el cuidado de la naturaleza. Estos son las fotos de la preparación de los promotores y promotoras de salud para atender las comunidades. Son varios tipos según las enfermedades que hay más en nuestra población. Es ahí donde nos preparamos. Ahí estamos utilizando las medicinas naturales que nuestros antepasados, ellos saben y ellos nos enseñaron a utilizar. Es un taller de capacitación de la herbolaria que nos están impartiendo organizaciones que ellos tienen mayor experiencia de las plantas medicinales. Nosotros como promotores y promotoras de salud tenemos casas donde podemos trabajar, atender los pacientes, pero las casas están construidos por parte de la comunidad, no está construido apoyado por el gobierno. Esas son actividades que realizamos en cada casa de salud donde atendemos las personas enfermas. Y también estamos realizando acciones de prevención y educación en salud. Estamos pesando los niños para ver en qué grado de desnutrición están. Estamos llevando a cabo también la vacunación, estamos promoviendo la salud bucal. Y también compartimos nuestras experiencias, conocimientos con otros promotores de salud en Chiapas y en los países. Estas son fotos donde estamos participando con otras áreas del trabajo de salud, donde compartimos nuestras experiencias, nuestros conocimientos y habilidades para que nosotros podamos atender, brindar nuestro trabajo en nuestra población. Nosotros tenemos planeaciones y tenemos trabajos para controlar nuestro trabajo. Son las metas de nuestro trabajo para ir llevando a cabo. Nosotros tenemos ya promotores de la propia comunidad que no vienen de otras comunidades, que no son de gobierno. Tenemos promotores avanzados que tienen mayor conocimiento de impartir talleres, temas, con los temas que es necesario para las comunidades. Revaloramos nuestras culturas y las integramos a nuestro trabajo de salud. Esas son fotos que son médicos tradicionalistas en nuestro estado. Son formas que ellos saben que son experiencias de varios años, millones de años, que han logrado tener. Nuestros logros, los grupos de salud han continuado su trabajo a pesar de tener un contexto conflictivo, un mayor conocimiento de la realidad de los diferentes, un mayor conocimiento, grupos y de lo que ocurre en el Estado y el país, intercambiar experiencias y conocimientos, un cambio en la conceptualización de salud que incluye la cultura, el género y el contexto en el que viven las personas, revalorización del papel de las mujeres, animar la participación de más mujeres, motivación más las comunidades, la red se ha mantenido gracias a nuestros esfuerzos e interés. Nuestros retos: lograr que el trabajo de los promotores, de las promotoras, sea reconocida por las instancias gubernamentales como el real de primer nivel de atención. Este reconocimiento debe facilitar que se realice una atención en salud con calidad, adecuada a la atención en salud, a las características culturales de cada región. No se trata de construir una salud pobre para pobres. Consolidar una visión de salud que incluye la cultura y el género. Realizar un trabajo que integre a los diferentes actores que trabajan en salud de las comunidades, hiloles, hierberos, parteras, entre otros. Los niños en Chiapas están defendiéndose contra la militarización. Gracias.
A continuación, el compañero Daniel Alarcón, de la Federación de Organizaciones Campesinas del Cordón Fronterizo Ecuatoriano de Sucumbíos, nos va a hacer presente el impacto que las fumigaciones del Plan Colombia están ocasionando en el Ecuador.
Buenos días a todos y todas. Mi nombre es Daniel Alarcón, vengo desde la provincia de Sucumbíos, de la frontera ecuatoriana, en donde el Plan Colombia ha hecho una destrucción a todos los cultivos alimenticios de nuestra población. En el año 2001 se implementa el Plan Colombia en el departamento de Putumayo. Las organizaciones asentadas en ese lugar han sufrido la peor parte de este plan, que no ha sido para el Ecuador, pero que de alguna manera ha llegado a afectar profundamente a más de 10.000 habitantes de ese sector. Es así como el Plan Colombia ha generado un desplazamiento masivo de nuestras comunidades. Forcofes, una federación conformada entre hermanos indígenas, negros y campesinos de todas las provincias del Ecuador, forman esta federación para contrarrestar a este plan infernal, a este plan de muerte que solo ha causado destrucción, hambre, pobreza y miseria en ese sector. Hoy vivimos lo peor. Gentes enfermas, nuestras familias, nuestros niños se están muriendo día a día y no hay un plan para poder contrarrestar a la epidemia que se ha desencadenado en los 340 kilómetros de frontera. 36.000 hectáreas de cultivos alimenticios totalmente destruidos. El gobierno ecuatoriano no implementa ningún plan de reactivación. Nos implementan un plan de militarización que genera el pánico, el terror y el desplazamiento de nuestros hombres y mujeres. Hoy ya el 60% de estas comunidades no viven en ellas. Hay pueblos fantasmas que de una u otra manera se han desplazado para poder sobrevivir con sus familias en otros lugares. El terror que se genera por los grupos armados de Colombia es el que está generando aún más pánico, que lo estamos viviendo día a día. Nuestra gente vive intensamente con ese temor. Serán desplazados por una u otra razón, ya sea por el Plan Colombia, sea por los grupos armados que amenazan a nuestras comunidades, hasta el punto que sectores denominados comunidades Puerto Mestanza, de 86 familias, hoy no tiene una sola viviendo en el sector. El mismo problema sucede en las comunidades llamadas El Betano, que escuelas se han cerrado, la gente ha corrido a otros lugares. A La Salina, de igual manera. Hoy estamos pidiendo a nuestro gobierno que no se incluya, no participe en el Plan Colombia, porque solo ha generado una guerra biológica para las personas que viven en el cordón fronterizo. El gobierno le está diciendo a Colombia no, pero Colombia nos dice conjuntamente con Estados Unidos que los ecuatorianos que vivimos en la frontera somos terroristas porque estamos defendiendo que no se sigan violando los derechos humanos de las personas que vivimos allí. Queremos que estos problemas lleguen a visibilizarse en el mundo entero, que sepan lo que está aconteciendo en la frontera, que sepan que nuestra gente se está muriendo, que hoy tenemos la baja de 17 personas muertas porque nos han fumigado con el glifosato. 12 personas, niños indígenas, han fallecido por esta situación. 5 adultos han perdido la vida porque se nos ha fumigado y han muerto con el efecto del glifosato. Nuestra gente sigue enferma. No hay su centro de salud en nuestra frontera para atender a nuestros enfermos. No hay un plan de desarrollo y la gente sigue sufriendo todo este embate de la fumigación. Queremos decirle a los Estados Unidos, que es el que implementó este plan, basta. Nuestros cultivos como plátano, la yuca, el arroz, el maíz, etcétera, etcétera, son ya devastados. Pero no queremos seguir saliendo de nuestras comunidades. Es el único patrimonio que tenemos para sobrevivir con nuestras familias. Y por favor, queremos un poquito de respeto. No sigan atropellando a nuestra gente. Colombia, por favor, que tenga piedad. Hemos pedido respeto a 10 kilómetros de fumigación en la frontera, en el propio territorio colombiano. Y eso no sea porque estamos confabulados con los grupos subversivos, sino que queremos que se respete a nuestra gente, que nos dejen vivir con un aire puro, con una salud buena, con nuestros ríos descontaminados, con nuestros cultivos en perfectas condiciones. Eso le pedimos, por favor, este mensaje al mundo entero. Muchísimas gracias a nombre de todos los compañeros.
Gracias. ¡Viva los campesinos de Colombia! The next speaker, Ecuador. ¡Viva los campesinos de Ecuador! The next speaker is Joanne Hubran. She is from Palestine, and she is a program manager for HDIP. This is a Palestinian health research group, an NGO. Is Tom Fothroff here? Not yet. Dr. Salam? Yes.
Buenos dias, everybody. When I wanted to do a presentation about the impact of the war on access to healthcare services in Palestine, I didn't want to include politics in my presentation. But then, as I was including the facts in the presentation, I discovered that health is very much related to politics and the difference, the development of the geopolitical situation in Palestine throughout the years. Just a small presentation about the development of the geopolitical situation of Palestine throughout the years. As you notice, in 1947, this was the Palestinian state according to UN partition plan. In 1967, this is the West Bank and Gaza as Israel occupied the West Bank. In 2000, this was the proposed Palestinian plan for Palestinians. This is the segregated West Bank. And this is Gaza. In 2003, Palestine now, as we live on it, looks like this. This is the West Bank, and this is Gaza. And all this development influences dramatically the development of an effective health system in Palestine. When we talk about the wall, we're talking about more than 750 kilometers in length around the West Bank and Gaza, and around the West Bank, the green part that you saw in the slide before. We're talking about 8-meter high solid concrete walls in some areas, 3 times as long and twice as high as the Berlin Wall. It contains also trenches of barbed wires, snipers, and watchtowers. And it is located just meters from schools, shops, and homes. This is the West Bank. The grey ones are the Palestinian communities. According to Israeli government, Palestinians cannot extend their communities. We cannot build and enlarge the communities. We should build according to a certain area. So since 1967, these Palestinian communities, the 600 Palestinian communities, remain the same number. The blue dots are the Israeli settlements, which are considered illegal according to international laws. These are on Palestinian lands, on the West Bank. I'm not talking about Israel. These are on the West Bank, Palestinian lands. The red dots are the checkpoints. We're talking about around 700 checkpoints, trenches, barriers, roadblocks, earth mounds, and I didn't include all of them on the map because if I do, the map will look all red. This line is the wall as Israel started it in 2003. It isolates 41 primary healthcare clinics and creates 28 enclaves, and around 425,000 Palestinians will be affected. This is the first phase that is already completed. The wall isolates 28 clusters, communities on Palestinian lands, separates people from their farmlands, from their schools, from their clinics, from hospitals. And this, the blue one, is the second phase of the wall, which is being completed now. And the green one is what Israel thinks will be the third phase of the wall, which is the western part near the Jordan Valley. So the West Bank will be like this. Instead of living on the West Bank is very small and compared to Ecuador, for example, it's very, very tiny. So if I live in Ramallah here, to go to Jerusalem, which is around here, it takes 45 minutes. But now it takes 3 hours if I have the permit. We're talking about clusters, enclosures, ghettos of small communities. Behind the wall, this is the green line, like here, the borders of the West Bank, and this is the wall. The wall will create 19 enclaves, and a total of 21 clinics will be isolated. The blue ones are the clinics. And there's another kind of enclosure, which is a complete enclosure, like ghettos, like in these areas, in Ramallah areas, in the south of Qalqilia. And it will isolate around 20 clinics. When we talk about isolation of clinics, we're talking about that medications will not be able to go to the clinics because the central storage is in the main cities like in Ramallah, Jerusalem. People cannot go to hospitals in Nablus, in other nearby cities, which is around 20 minutes by car. But even now, when the wall is not complete, people cannot go to their clinic, to the hospitals, because they cannot use the main roads, which is only restricted to settlements. And if you want to use it, you have to use it through permits, and through public cars, you cannot use your own cars. This is what we're talking about. This is the wall. See, it isolates. People live, for example, in this house, their neighbors live at the other side. They separate families. This is Qalqilia, a photo of Qalqilia. Qalqilia has 40,000 people, and this is the wall surrounding them. This is Israel here. This is the highway to Israel. So the wall is like a ghetto. And only there's one door here, one gate, controlled by checkpoints that allow people to go in and go out to other areas in the West Bank, Palestinian lands. And the wall also separates the villages here from the main hospitals. In 2004, there was no hospital serving the communities here. But now there's a new clinic to serve because there's a 70-year-old man who died on the gate because he couldn't go 3 minutes away to Qalqilia because the soldiers did not let him go in. When we talk about the impact on healthcare services, this is the normal distribution of Palestinian communities, and I don't know if you can see the blue crosses are the clinics. The clinics were situated in communities according to WHO standards. That means the accessibility of clinics to the communities, the levels. Now we're talking about checkpoints, the red ones here. And this is the wall. These are the gates, because the wall is controlled by gates. And on the entrance and exits of village, there are gates. In some villages, people cannot go out and go in without Israeli permissions. This is the second phase of the wall that is being built now. So all access to healthcare services are obstructed. If we're talking about Qalqilia to Nablus, this is Qalqilia to Nablus, 20 minutes by car. This road is now not accessible to use by Palestinians, only to settlers, and you need permits to use it. Nablus has the main specialized services which Qalqilia does not have. So because it's very near, there was no need to develop health systems in Qalqilia. These are the checkpoints. People could go, it would take them 2 to 3 hours, but people would go to hospitals. This is the wall now. These are the gates, the green crosses. And this is the second phase of the wall, which means a total obstruction of geography of Palestine. People cannot go easily to hospitals, and they cannot go to nearby villages. This is the beginning of the construction of the wall near Jerusalem area, and it looks like this now. We're talking about a new geography of segregation that impacts the access to healthcare services. There's a clinic here that used to serve all the communities around. Okay. Aqaba used to go to this clinic. and the villagers used to go to other nearby clinics. With the checkpoints, it was difficult, and the wall now, there is no access to this clinic. This clinic only serves the communities inside the wall, and there are no roads, so people use their donkeys, their dirt roads. Also, the staff that used to work in clinics used to come from nearby villages, but as you see here, they cannot go to the same clinic. We're talking about accessibility of gates. We have no specific opening hours. These are the gates. And we can see here that they open around 20 minutes in the morning, 20 minutes in the afternoon, and 20 minutes in the evening, which means that patients should know when to get sick. Children also are impacted because they have to go through gates, and around 3,000 children could not continue their education. We talk about lots of cases of denial of access of medical staff. Around 400 cases, patients and ambulances, medical staff were denied access to villages around the whole area. We're talking about a system of 700 checkpoints, the red ones on the map. These are the example of checkpoints. This is the case of a journalist who got shot by Israeli troops on the 11th of July 2002, and Ahmad died because he was denied medical care. And this is Nasser Shtayeh. He's a journalist. We work with him. He's a good photographer. He wanted to go to document a case about a child who died on a checkpoint. Then he discovered it was his own child, 4 days old. And the Israeli soldiers denied her mother access to go to hospital. We're talking about 86 people who died on checkpoints, and 30 of them were children, 20 newborns. This is Aisha, who needed kidney dialysis 3 times a week, and she died because Israeli soldiers would not let her go to the hospital. We're talking about the impact of 33,000 chronic disease patients and disabled individuals that will be affected by the wall. The response of medical organizations is great, because they organize trainings for medical staff, mobile clinics. There's the first scene on clashes and invasions, and they do provide health and social advice. These are some of the examples of field clinics also, and we cooperate with Israeli organizations to go in areas where medical staff cannot go inside through the gates. So Israeli medical organizations help Palestinians to do more lobbying. The International Court of Justice decided that the wall is illegal, and Israel is under an obligation to terminate its breaches of international law, to cease forthwith the works of construction of the wall. But this is not happening. On the ground, the wall continues. Palestinians on the ground, they continue with non-violent resistance. Whenever the Israeli soldiers with bulldozers come to erase lands and trees, we go on the ground, we do demonstrations, peaceful demonstrations. And this is what we call on the international community to come along and do more support to Palestinians in this area. Because we believe that freedom is our basic right. Thank you.
Bien, falta un ponente que nos va a hablar con el silencio. Lo vamos a hacer presente en esa silla que está vacía, porque nuevamente el poder ha impedido que pueda hablar. Iba a participar con nosotros Ernesto Pérez, de Chile, y nos iba a hablar sobre la impunidad y los detenidos y desaparecidos por el caso Pinochet. Sin embargo, viajando por tierra y llegando al Ecuador, en la frontera, la policía de migración impidió que entrara, se negaron, insistieron en la negación, les tuvieron 24 horas retenidos y los devolvieron a su país. Vamos a pedir a este auditorio 2 cosas. Uno, un fuerte aplauso para Ernesto por el esfuerzo que hizo en venir por tierra y porque nuevamente se comete contra el pueblo de Chile una violación más de silencio. Esta organización hará llegar los aplausos de ustedes. Pero también queremos pedir que lo mismo que aplaudimos el esfuerzo y la valentía, tenemos que denunciar a quienes se encargan de cometer estas violaciones. Y pedimos también una gran rechifla contra la policía de migración que sigue oponiéndose a que la verdad se haga pública.
¡Viva el pueblo chileno! ¡Viva! ¡Abajo el fascismo! ¡Abajo! ¡Rechazo! ¡Terrorismo!
Bien, damos la bienvenida al último participante. Sí.
The next speaker who will give a testimony on the orange agent from Vietnam is Mr. Tom Fawthorne. He's from the United Kingdom. He is a journalist in the Asia-Pacific region, so he's anywhere and everywhere, basically.
Friends, brothers, sisters, my name is Tom Fawthorne and I'm a journalist based in Southeast Asia, and for many years I have been covering this issue of Agent Orange. Just to very briefly introduce you, Agent Orange was a herbicide sprayed during the Vietnam War. They started in 1961. They sprayed from 1961 up until 1971. They sprayed 80,000 liters of these herbicides, which contained a very high concentration of dioxin. It was only, as I say, only stopped after 10 years. There were protests by many US scientists. There were protests from around the world that this constituted chemical warfare and should never have been started in the first place. What was the logic? The logic of the chemical spraying was to destroy the rainforest and the food crops which sheltered the resistance, popularly known as the Viet Cong, the National Liberation Front of South Vietnam. The Americans were losing the war, their client regime in Saigon was losing, and so they resorted to desperate and dirty tactics to destroy the jungle cover for the guerrilla forces. And now I'm going to show you just a few pictures of some of the results of this legacy that still plagues Vietnam today. This child is one of about 150,000. The 800,000 is all the people suffering from serious illnesses in Vietnam. That's children, adults, everybody. but this child is one of 150,000 who are living an appalling life. They're crippled. You can see her right hand is contorted, twisted. This is a very common. There, you can see that the hand is twisted upwards. I have to tell you that the pictures that I'm showing here are by no means the worst. There are much more horror. Here, you can see she has only part of her legs. I just go back to this one. One of the important points to know is, although the Vietnam War ended in 1975, that's 30 years ago, this toxic legacy continues to this day. And that the dioxin in the Agent Orange enters into the bloodstream, and mothers can pass on to their children and their grandchildren. This is now the third generation suffering from Agent Orange. Okay, after a great many years of nothing happening in terms of the Vietnamese victims, I should first of all explain that in the United States, American soldiers, war veterans, also complained of many illnesses as a result of Agent Orange just by handling it, even though they were much less directly exposed. In 1985, they sued Monsanto Corporation, Dow Chemicals, and other big companies in the United States that had the contract from the Pentagon to supply Agent Orange to US military forces in Vietnam. They won an out-of-court settlement for a not, by today's standards, a not very large amount of money, and they signed away their rights to take any further action against the US companies. But in 2004, the Vietnamese NGO called the Vietnamese Victims of Agent Orange and Dioxin, they launched a class action lawsuit in the United States. This case has been kicked out by the US judge, but it is now on appeal. What is consistent in this whole story, this very sad human tragedy, is that regardless of whether it was a Democrat president or a Republican president, all US administrations have absolutely refused to give any kind of humanitarian aid earmarked for victims of Agent Orange. They have refused to accept any responsibility for the consequences of Agent Orange spraying, which destroyed not only people but jungle as well. And despite constant appeals from Vietnamese scientists, at least do the decent thing and help us to decontaminate the most toxic areas which are still around the former US military bases, the United States government has shown absolute refusal and consistent state of denial that they have any responsibility at all. Right, that's the end of the show. You know, I was going to read some testimony from... Sorry, it's not me. Do I have to? So the final point is we have a documentary on Agent Orange for those people who would like to know more. It's a 50-minute documentary and it's won several awards in international film festivals. At the moment I don't have the details of when it's going to be shown, but it's called Battles, Poison, Cloud. and it's the filmmaker Cécile Tambousier, who is a filmmaker in London. And the other thing is, I regret there has not been any Spanish in this presentation, but the translation of the Agent Orange story will appear in the Alert conference newspaper tomorrow. They've translated it, or it might be out later today. It's either coming out today or tomorrow. There will be a Spanish, the Spanish translation of an article I wrote yesterday. Thank you very much.
Ladies and gentlemen, let us all give a big hand for the panelists this morning. Thank you very much. You may now step down, and may I ask the next set of panelists to please come up the stage. Well, we've seen all the testimonies. You see what greed and the greed for profit can do. Now you'll hear more of that with our next set of panelists. Our first panelist for this morning, he is a doctor from Iraq, and you've read his article in the newspaper that came out yesterday. He was, it took a lot for him to be shipped from Iraq to give his report here in Cuenca. He was not in the original list of panelists, but we have to give him this chance so that he can report to us on what is really happening in Iraq. Ladies and gentlemen, Dr. Salam.
I'm sorry, but it's a lot of papers of 2 years. I just wanted the presentation. Yes, on the CD. First of all, ladies and gentlemen, I'm so glad that I am here. And before I give a brief of my position and the rest, I would like to thank from the deep of my heart, really from the deep of my heart, Aid for the Third World, Dr. Bird. I want to thank Mid-Act for just one thing. They gave us a chance to speak about a crime for 2 years. A crime happening every day in Iraq until this moment, and nobody knows about it. From deep of my heart, I have to thank them. The other issue I want to say is, I want to stand just for 1 second of silence for each Iraqi medical professional give their life in 2 years until now to save the life of patients who no one knows about them. Thanks a lot, and my name is Dr. Salam Ismail. I am Iraqi doctor, ordinary Iraqi doctor. I was chief of junior doctors in Baghdad Medical City after the war, elected democratically, not on the American way. And also I was chief of junior doctors in my hospital, and now I am general secretary of Doctors for Iraq Society, which is an Iraqi, small, volunteered, poor NGO by brave Iraqi doctors. First of all, I will start is the health
sector situation in 2 years of occupation. Well, I am not a professional in making presentations, but this is the first time. First of all, we will look to, this is the situation during the sanctions. Already the situation in Iraq as a health system had been completely destroyed. If you know, before the sanctions, Iraq was one of the best countries, even in more than European countries in the health sector. We have brilliant doctors, we have good facilities, and we have the less mortality between the children in the Middle East. This is another picture. I gave this picture for 2 years to show you what I call tsunami that happened in Iraq. It's happened in Fallujah. It's part of the health system that we are in, which is all of it have been destroyed. First of all, I will speak civilian casualties. Well, first of all, according to the international law and Geneva Conventions, which part 4 is saying that each military conflict sides have to discriminate between the civilians and who make hostile activities in their attacking. And that's not happened in Iraq. There's no single, I'm saying here, no single report or estimation legally and officially until now in Iraq by any side about the casualties, the people who innocent who died in Iraq for 2 years. Some said 60,000, some said 17,000, some 100,000, and I think the best one was the estimation of the Lancet British journalists said minimum 100,000. But for us as Iraqi doctors, our estimation of our small group until now is not less than 150,000 Iraqi civilians have been killed in this war. And I hope that the Minister of Health have his own courage without the pressure of the Americans to make one report about the civilians. Destruction of the infrastructures. Well, the infrastructures have been just completely destroyed. We're turned back to the zero level. If we are under Saddam Hussein, we were on the level of 5 or 4. Now we are on the zero. What the main thing happened after the war is the looting. From 18 biggest hospitals in Baghdad, 11 have been looted completely. We are, as doctors, we are on the roof of the hospitals carrying guns to prevent looters from entering our hospitals. This is our job. Doctors have to act in this way. According to the international law, the age complex side have to protect the facilities of the health and hospitals and public services during the war, which not happened in Iraq. As destruction, I will give you just two quick examples, and you can know what the meaning of infrastructures. First example, we went to survey in the Basra, in the south of Iraq, to see one of the biggest problems that we are facing. I am an orthopedic surgeon, and I know what the meaning of amputation. During the war, we just amputate the legs, the limbs, the arms. We don't care, just to save the patients. But after that, we have amplified bomb. People start to come us with many problems of prosthesis. We went to Basra to make a survey about the prosthesis. In the south of Iraq, there's only the ice bridge is 2,000 child until now need prosthesis in the south of Iraq, 2,000. But if you know that because of looting and destruction of the clinic in Basra, do you know how much the waiting list for the child? The waiting list from 6 months to 1 year to have a prosthesis. But if you know that each child, to have a prosthesis, each child needs one prosthetic limb each 2 to 3 months because he's growing. So how can he cope with that? And I went there, I astonished. They have no materials, all of it looted, and big problems. This is prosthesis. But I will give you another distressing example, is radiotherapy. My uncle died because he had brain cancer, because he needed radiotherapy, and because the waiting list for radiotherapy is 6 months to have single shot of radiotherapy. And he died before he reached his own turn. for radiotherapy. Water and sanitation. Before I came here, we were under the siege of American troops in the west of Iraq because of the newest military operations. I managed to smuggle inside Fallujah because they don't let us to enter Fallujah. 7,000 inhabitants in a small area of Fallujah. They drink water. This is the water situation actually. This is from Fallujah. They are drinking water directly from the river. And if you know what makes the disaster is more, that those 7,000, because before the previous regime, there is irrigation water from the farms carried through specific canals and thrown away, not in the river. After the liberation of the occupation, or the liberation of the Americans, these projects have been stopped, so the government started through the irrigation water, which contained the salt, the chemical materials in the river directly. And those 7,000 drinking from the river, and we end many cases of infectious disease. I astonished how many people there from 7,000. This is simple part. The other part is one of our hospitals in Baghdad, the capital of all Iraq. It's called An-Nur. They don't get only 15% of the water, clean water they needed. A hospital get 15%. This is the pipe from the river directly. Before I go to there is called another thing, which is electricity. How you can work if you have no electricity? I lost, in 2004, 2 patients. They are on ventilator because electricity had been cut from the hospital. They were on ventilator and we have no generators. This is a simple thing about what the meaning of infrastructures. I will come to something called medication. Even medication in Iraq is now hard to be achieved. Medication, if you know the one of the list report in Iraq, shows that between 900 drugs needed, 45% not available. 45% of the most essential 900 drugs. And the rest is 39% only for the next few months available. But the most important problem that's nobody trying to realize, that we have no, until now, single supervision on the borders or any drug entering Iraq. Our estimation as doctors, we made a small survey. We found that about 40%, it's about 40% of the drugs that enter in Iraq with no single supervision. No being tested. So, where's the government and where's the Ministry of Health? I know for this. The other thing is the corruption, which is one of the biggest problems. That maybe after each war there is a corruption. Before Saddam Hussein regime there is a corruption. But the corruption with the Americans situation amplified more and more. And don't say that Iraq is only corrupted. No, the Americans contractors are also corrupted. I will tell you how. I will just have a few seconds from you. I'll give you 2 examples of corruption. How the ugly of corruption destroying our country. I'm just feeling shame sometimes going to Europe to ask for help for junior doctors or for the hospitals. Because I'm sorry to say it, I didn't come from Africa, they have no sources. Iraq is the richest country in this world. Have 4 main sources: oil, tourism, minerals, agriculture. So, all that money goes where? All that money goes where? A lot of money in Iraq now. And the Americans said, well, we'll give you $1 billion. Just give us the money of the oil, and that will be free and that will be okay. just as one example of corruption. I came back from UK to my hospital. I found them changing the marble of the front yard of the hospital, and they are filling the departments with laptops from HP, while the only pharmacies in my hospital have no enough medication for 2 months. I was part of the managing council of my hospital in 2003. We asked them, we have no cannulas for patients for successive 2 weeks. We just need an urgent money to buy these cannulas for patients. They said, well, we have no money. After 1 day, just 1 day, they put announcement. They bought suits for the reception employee by 5 million Iraqi dinar. Because the suits you can corrupt and get money from, while the drug is not. And last example of corruption, they announced, they put a person who had been committed during Saddam Hussein regime a crime of corruption of 32 million Iraqi dinar and been just kicked out from the hospital. After the war, he came back with a critical position in my hospital. This is the democracy and this is the corruption. Privatization. I'm sorry, but maybe I will have a few seconds from you, a few minutes, because it's 2 years. Privatization is started. I will give you the only example, which is a good example for you, everyone. After the war, before the war, all the hospitals in Baghdad, the old regime imposed on these 2 factories that producing liquid oxygen to supply all the hospitals with this liquid oxygen with 150 Iraqi dinar, with a good quality actually. After the war directly, these 2 factories become independent and 1 liter of liquid oxygen jumped from 150 Iraqi dinar to 1,800 Iraqi dinar. And we are in Baghdad, we have no oxygen 3 days per week. No for emergency, no for elective. And when I went to UK actually to ask for help to a simple solution, buying a portable unit of oxygen, produce enough oxygen for 5 hospitals, which is only cost £50,000.